So, hello students, and let us today understand the important topics of head face neck. वैसे head face neck in itself is a very vast topic. So, बहुत दिन से बच्चे बोल रहे थे कि important topics का list दो. So, I prepared this lecture specially for you. And students, watch this lecture till the end so you get an idea of the must-know topics of head face neck. You can write the answers for this. You can send it to me. I'll assess this and I'll tell you whether it's correct or not and how much to write. Clear? Okay, so let us start with the important topics, starting with the LAQs. I tell you always, bacho, that LAQ always comes described under the following heads, right? And LAQ for 12 marks or 10 marks, whatever it is, describe under the following heads, A, B, C, D, and those heads will be specified. You have to just answer to those heads. ठीक है. And when you prepare one LAQ, बहुत सारे SAQs automatically prepared हो जाते हैं, right? So one LAQ is equivalent to 3-4 SAQs. So the first question, scalp. Scalp में you have to know the layers of the scalp, right? So you first have to enumerate or you have to describe the layers of the scalp. उसका arterial supply, venous drainage, nerve supply, very important. And then clinical application of the scalp, the dangerous layer of the scalp, avulsion of the scalp, right? Cephal hematoma, 3-4 clinical points you can always mention. Clear? So the layers of the scalp you can write, you can draw a diagram, and diagram is very essential for an LAQ. The scalp is a very important question. Now the second question is posterior triangle of the neck. And students, remember, posterior triangle of the neck is a very important LAQ. बहुत important clinically भी है, because the nerve which lies in the posterior triangle is the spinal accessory nerve, and damage to the spinal accessory nerve in the posterior triangle of the neck would lead to paralysis of trapezius, not sternocleidomastoid. Trapezius is paralyzed. The person complains of difficulty in shrugging of shoulders, difficulty in overhead abduction, and the swinging of scapula at rest. So posterior triangle ke boundaries you have to write, the floor you have to write, the prevertebral fascia you have to mention. You have to mention about the roof of the posterior triangle, which is formed by, yes, investing layer. Plus you have to write about the external jugular vein and the branches of cervical plexus. And then the contents of posterior triangle, spinal accessory nerve, then, yes, the brachial plexus, yes, the subclavian artery, the cervical plexus, the occipital artery. Fine. And the clinical applications you can write of the posterior triangle. A very, very important clinical MCQ also. हाँ, ये clinically भी पूछ सकते हैं. A short case can be given. ठीक है. A person is, a person comes with swelling in the posterior triangle and a biopsy is to be done or a lymph node is to be removed. The lymph node जब निकालते हैं, the spinal accessory nerve gets damaged. Remember that. हाँ? So that's a clinical MCQ. Now coming to the next, the cavernous sinus. Cavernous sinus is another very, very important LAQ. So enumerate the dural venous sinuses. That's how the question is. अब dural venous sinuses and our students what they write and come, the various air sinuses the students write. The frontal air sinus, maxillary air sinus. No, that is wrong. These are the air sinuses. क्या सवाल पूछा है? Enumerate the dural venous sinuses. So venous sinuses you have to describe as paired and unpaired. So paired में क्या क्या है? हाँ, the transverse sinus, the superior petrosal, inferior petrosal, है ना? About those, the cavernous sinus, the unpaired superior sagittal, inferior sagittal, straight sinus, occipital sinus, ऐसे लिखना है, ठीक है? So I'm just telling you in short, okay? So paired and unpaired sinuses, okay? Then you have to describe about the cavernous sinus, the extent of cavernous sinus, the location of cavernous sinus, the relations in the lateral wall, in the floor, in the roof, and the medial wall of the cavernous sinus. And then you have to write about the tributaries of the cavernous sinus. ये tributary short note भी आता है, MCQs भी आते हैं. The draining channels of the cavernous sinus. And finally, the clinical application. Any infection in the dangerous area of the face goes to the cavernous sinus, causes thrombosis of the cavernous sinus, right? So अगर thrombosis होता है तो there is pain along distribution of 3, 4, 6 nerves. Then you have to write about the pulsating exophthalmos. So that's cavernous sinus, a very important LAQ. Then comes to the muscles of mastication and TM joint. Muscles of mastication, origin, insertion, nerve supply, action. जैसे आप कोई भी muscle का लिखते हो, you have to know the the origin, insertion, nerve supply, action of this 4 muscles of mastication. Bachcho, again there's a lot of confusion in the muscles of facial expression, the muscles of mastication. This all are muscles of facial expression derived from the second pharyngeal arch. The nerve is facial nerve. The muscles of mastication are 4: temporalis, masseter, medial and lateral pterygoids, derived in the first pharyngeal arch. The nerve is mandibular nerve. Mandibular nerve. So just remember this, a very clear differentiating point. Clear? No confusion in this. Buccinator, again, बहुत students बोलते हैं buccinator is a muscle of mastication. No, buccinator is a whistling muscle, a muscle of facial expression derived in the second pharyngeal arch, supplied by facial nerve. Correct? So muscles of mastication के बारे में लिखना है, तो वो 4 muscles हैं, and the only muscle of mastication which causes depression of the mandible, yes, the lateral pterygoid. Lateral pterygoid, बाकी जितने भी muscles हैं, they cause elevation of the mandible. So once you're done with the muscles, then you have to write about the TM joint, the condyloid type of synovial joint. उसके relations लिखना है, lateral medial relations, and the movements, then the muscles producing movements. Movements is elevation, depression, protrusion, retraction, and side to side movements, and the muscles causing them. For dislocation of the TM joint के बारे में लिखना है. हाँ, dislocation is very common when you yawn with a very widely open mouth. The mandible dislocates anteriorly. So उसको पीछे push करके ऊपर push करते हैं, backwards and upwards. That's how you fixed a dislocated TM joint. Fine, clear है बच्चों? So muscles of mastication, TM joint, very important LAQ. Perfect. Now coming to the glands now. ये तीनों glands important है. एक है thyroid, एक है parotid, एक है submandibular. So coming to the parotid first, parotid gland, it's a triangular, 3 triangles put together. वो लिखना है, उसके surfaces लिखना है, superficial, anteromedial, posteromedial, borders के बारे में लिखना है, base apex के बारे में लिखना है. Then you have to write about the capsule of the parotid gland, which is formed by the investing layer of the deep cervical fascia. Fine. Then you have to write about the relations of the parotid gland, the contents of the parotid gland, superficial to deep, the facial nerve, the retromandibular vein, and the external carotid artery. हाँ, वो लिखना है आपको. Fine. Then you have to write the nerve supply of the parotid gland. This is asked as a short note also. ये short note भी पूछता है, nerve supply of parotid gland. हाँ, you have to start from the inferior salivary nucleus to the parotid gland. हाँ, the parasympathetic nerve supply. And then उसका clinical application लिख सकते हो about the mumps. हाँ, then parotid duct के बारे में लिखना है. हाँ, parotid duct. Then stones in the parotid duct लिख सकते हो. Parotid gland के tumor के बारे में लिख सकते हो. Fine. Clear? So mumps is a viral infection of the parotid gland, and infection of this parotid can lead to sterility. Okay, just remember that in males. Right? So that's about the parotid gland. Thyroid gland के बारे में भी you have to write the 2 lobes of the thyroid gland, the isthmus, the apex, the base, and the various surfaces of the thyroid, the relations of the thyroid. वो एक transverse section का diagram दिया है, मैंने notes में भी दिया है, मैंने book में भी पढ़ सकते हो आप, the TS of the thyroid. फिर coverings of the thyroid gland, the pretracheal fascia के बारे में लिखना है, why the thyroid moves with deglutition वो mention करना है, why the thyroid swelling cannot go upwards, right, because it is fixed to the thyroid cartilage. हाँ, वो उसके बारे में लिखना है. Ligament of Berry, it doesn't go down into the mediastinum because of the ligament of Berry, suspension of ligament of Berry, उसके बारे में लिखना है. And then very important is the blood supply of thyroid, the superior thyroid artery कैसे आती है, anterior posterior branches, and then how it anastomosis on the isthmus, the anterior branch, and the posterior branch anastomosis with the inferior thyroid artery. Then you have to write about the nerves which accompanies this artery, the superior thyroid artery with the external laryngeal nerve, the inferior thyroid artery with the recurrent laryngeal nerve. उसके relations याद रखने हैं, and where you ligate the superior thyroid artery and the inferior thyroid artery to prevent damage to the external and the recurrent laryngeal nerve. That's very important. Very important. ये clinical में भी आ सकता है. A patient came to with a swelling of the neck. Thyroidectomy was planned. The thyroid is removed. Later, the person complains of loss of, the timbre of the voice. Loss of timbre, मतलब वो जो high pitched voice है ना वो कम हो जाता है. So which is the nerve injured? External laryngeal nerve. Okay, so that is something that you have to mention about the thyroid in clinical applications. Fine. Submandibular gland वैसे तो नहीं आता है, but if it comes, you have to write about the C-shaped J-shape, not C, the J-shape structure of the submandibular gland, the superficial part, the deep part. Superficial part triangular होता है, उसके relations आपको लिखना है. The deep part turns around the mylohyoid and goes inside the deep inside. उसके relations आपको लिखने हैं. Then you have to write about the submandibular duct. Where does it open? Fine. The nerve supply of the submandibular gland, the facial nerve, and उसका pathway आपको लिखना है. And then the clinical applications. Okay, submandibular gland generally doesn't come, but read it and keep. Fine, bachcho? Okay. Then coming to the larynx. Larynx is another LAQ. Larynx mein under the following heads aata hai. So you have to write about the muscles. You have to write about the first the structure of the larynx. Structure kahan se kahan tak extend hota hai. You have to write about the cartilages of the larynx, the paired and the unpaired cartilages. Then you have to come to the muscles of the larynx. Okay, not everything is important. Just important muscles yaad rakhna larynx ke. And then you have to write about the nerve supply above the vocal cords, below the vocal cords, that's sensory nerve supply, and the motor nerve supply of the larynx. All the muscles are supplied by, yes, recurrent laryngeal nerve, except cricothyroid, which is supplied by external laryngeal nerve. Blood supply, superior laryngeal artery, inferior laryngeal artery, which is a branch of superior and inferior thyroid artery. Okay, and then you have to write about the interior of the larynx. You have to write about the quadrate membrane. Okay, the cricovocal membrane, the vocal folds, the vestibular folds, the rima vestibuli, the rima glottitis. इसके बारे में लिखना है, diagram draw करना है. And then you have to write about the clinical applications, right? What is hoarseness of voice? What is huskiness of voice? What is singer's nodules? Then when a person plays this trumpet, so what happens? There's a diverticulum which is developed in the larynx. वो सब आप लिख सकते हो. Okay, 3-4 points you have to mention in that. Then coming to the tongue, students are very important. LAQ is tongue because इसमें histo भी है, embryo भी है, gross भी है. So you have to first explain the morphology of the tongue, the superior surface, the inferior surface of the tongue, the tip, the base. फिर कैसे tongue is attached to the epiglottis by glossoepiglottic folds. Then you have to explain about the anterior 2/3 posterior, 1/3 posterior most part of the tongue, which papillae you get in the anterior 2/3 posterior 1/3 पे, what are the lymphoid tissue that you get, lingual tonsil वगैरह वो लिखना है. Then you have to write about the intrinsic and the extrinsic muscles of the tongue, intrinsic and extrinsic muscles of the tongue. Then उसका short में discuss करना है, describe करना है. And then you have to write about the nerve supply, very important. Motor nerve supply, sensory nerve supply. Motor nerve supply, all the muscles supplied by hypoglossal nerve except palatoglossus, which is supplied by pharyngeal plexus. And then sensory nerve supply, anterior general sensations, special sensations, anterior 2/3 posterior 1/3 posterior most part of the tongue. That's about the tongue. Blood supply, lingual artery, and then paralysis of the tongue. Paralysis of hypoglossal nerve leads to paralysis of genioglossus on the same side. The tongue is deviated to the same side of lesion. Very important. ये clinical सवाल भी आ सकता है. A person comes with deviation of the tongue to the right side. So the right genioglossus is paralyzed. वो याद रखना आपको. दूसरा एक है palatine tonsils. Yes, palatine tonsils sometimes, yes, it does come as an LAQ. So you have to write what is palatine tonsil, उसका location, उसका tonsillar fossa, anterior boundary, posterior boundary, roof floor, and the lateral relations of the palatine tonsil, the tonsillar bed जिसे हम बोलते हैं. Then you have to write about the medial surface of the tonsil, the tonsillar crypts के बारे में आपको लिखना है. ठीक है. Blood supply, nerve supply of the tonsil, and then the clinical application, tonsillitis, what is quinsy that you have to mention, and tonsillectomy that you have to mention. ठीक है. Okay, बच्चों, just remember this. And the middle ear, बच्चों, very important is middle ear. So middle ear के just the boundaries of middle ear, roof floor, anterior, posterior, medial, lateral walls के बारे में लिखना है. Relations are very important of the middle ear, and the diagram you have to remember. Diagram of the middle ear cavity. That's very important. This is something that you have to know. ये MCQs में भी आता है, right? And then you have to write about the nerve supply of the middle ear cavity. That's glossopharyngeal nerve, tympanic plexus, the blood supply in short, and then clinical application is very important. What is otitis media? What is chronic suppurative otitis media? That you have to write. Fine. So these are the LAQs. the must know topics of head and neck, the LAQs, very important. And ये LAQs जब आप prepare करते हो तो automatically you prepare 3-4 SAQs also. ठीक है? So coming to the SAQs, SAQs of head and neck, the venous drainage of face and the nerve supply, sensory and motor nerve supply of the face. एक है ना LAQ में मसल्स ऑफ फेशियल एक्सप्रेशन कभी कभी पूछते हैं, कभी कभी मसल्स ऑफ फेशियल एक्सप्रेशन, ठीक है. वीनस ड्रेनेज ऑफ फेस, यू हैव टू राइट अबाउट द डेंजरस एरिया ऑफ द फेस. द सेंसरी नर्व सप्लाई ऑफ द फेस इज वेरी इंपॉर्टेंट. ऑफ्थाल्मिक मैक्सिलरी मैंडिबुलर के ब्रांचेस मेंशन करने हैं, राइट. Ansa cervicalis, Ansa cervicalis is very important. Ansa cervicalis ये MCQ में भी आता है. What is Ansa, कैसे फॉर्म होता है, where does the Ansa lie on the anterior wall of carotid sheath, and what are the muscles supplied by Ansa cervicalis? All the strap muscles except thyroid, and thyroid is supplied by C1. दूसरा जो मसल है that is geniohyoid, which is supplied by C1. So Ansa cervicalis का beautiful diagram you can draw. Right, and you can write about Ansa, very easy, short note to write. Mandibular nerve, but mandibular nerve is a must. Mandibular nerve is very important as a SAQ, as a for you to know also, because अगर mandibular nerve आती है ना, you know half of the head and neck. Okay, because somewhere or the other mandibular nerve के branches, the divisions always comes. So mandibular nerve के बारे में लिखना है, trunk, anterior, posterior division, उसके branches के बारे में लिखना है, ठीक है. Coming to the next, the constrictor muscles of the pharynx, the superior, middle, inferior constrictor के बारे में लिखना है. You have to write about the meat and raphe. You have to write the gaps between the constrictors, the gaps between the superior, middle, inferior constrictors, the structures passing between the constrictors. ये याद रखना है आपको. The nerve supply of all the constrictors. Right, pharyngeal plexus except cricopharyngeus part of inferior constrictor, which is supplied by external or recurrent laryngeal nerve. Fine. Lateral wall of the nose, ये कभी कभी diagram भी आता है, तो you have to just mention the conchi, you have to mention the meatus of the nose and what structure opens in which meatus, inferior meatus, middle meatus, superior meatus में कौन से structures खुलते हैं, that you have to mention. That comes in SAQs also, that comes in MCQs also, sorry. Okay, branches of external carotid, yes, ये वाइवास में भी पूछते हैं. Be very specific. Anterior branches, posterior branches, medial branches and terminal branches के बारे में लिखना है. हाँ, ऐसे आएंगे तो full marks मिलते हैं. Enumerate, name, इसमें full marks मिलता है. Extraocular muscles, yes, you have to write about the recti, the oblique, the origin, insertion, nerve supply and उसके actions. All the extraocular muscles are supplied by third nerve except lateral rectus, which is supplied by fourth, lateral rectus which is supplied by sixth, and superior oblique which is supplied by fourth nerve. Fine. And embryology में pharyngeal arches and cleft palate. Pharyngeal arches में you have to know the nerves of the arch, you have to know the muscles of the arch, the cartilages, the bones of the arch and the artery of the arch. That's very important. ये हमेशा पूछते हैं. Pharyngeal arches, the first arch, the second arch, हाँ ऐसे. वाइवास में भी पूछते हैं. एम्ब्रियो के टेबल्स पे टेबल वाइवा में भी पूछते हैं. Cleft lip and cleft palate, the development of face, how the face is formed, how the cleft lip occurs, the cleft palate कैसे बनता है. Just see the lectures for details. Everything is covered in the lectures. So this is the list of the SAQ topics which are asked. बच्चों इतने topics कर लो. This is more than enough. If you do something else, it's an additional benefit for you. Knowledge doesn't go waste. है ना. तो just keep on learning. इतने topics आपने लिखा, you send it to me, I'll assess it and then I'll send it back to you. So बच्चों ये टेलीग्राम चैनल है, इसे स्कैन कर सकते हो. You can be on the group of Telegram. This is my Instagram handle. छोटे छोटे रील्स में डालता हूँ, educational reels only specifically for you. अभी recently मैंने 30 days Viva challenge किया था, तो उसमें some important Viva questions we had discussed and that's a YouTube channel. Okay बच्चों, so continue watching the videos. I'll come up with more important topics for you. Thank you so much.